Aloha, my name is Dr. Nick with Island Holistic Healing, and we are on the big island of Hawaii. Now today, what I'm going to go over with you is I'm going to go over stage 4 in preparing you on the path of how to achieve optimal health in your physical body, okay? Stage 4 is utilizing blood laboratory analysis so that you can stay on top of your health for the rest of your life and to be able to monitor your physical well-being so that you can track every 6 months and see if there are any changes taking place that are going in the wrong direction, okay? So one of the things that I try to always convey with my clients is that when we do a baseline laboratory analysis, baseline being before any water fasting has commenced, okay? What we're most likely going to see is not much, okay? Unless we've seen some history of all of these tests that we can do a comparative analysis so that we can see changes that have taken place over a period of months and years, okay? And without that information, typically what we're going to be looking at is something that is not that drastic, not a whole heck of a lot. Blood laboratory analysis for baseline is very useful when there is a serious problem in your body, okay? When there's not a serious problem in your body, you're not going to be able to identify anything too extreme, okay? So this information is very important for you to be able to monitor small changes over time and big changes in a short period of time when you undergo a water-only fast. Okay, the other time when you're going to see drastic changes and where this can be very useful is in times of infection and serious symptomatic health decline in a short period of time. When that occurs, we need to see what's happening right now in that moment, okay? Now, if you are already, by the time you're watching this video, already on top of what we went through in the previous videos where we went through stage 1, stage 2, and stage 3, and you're living a relatively very healthy life, you probably will not get into any major health challenges unless you were already having some major health changes or challenges prior to undergoing current lifestyle changes, okay? So prior to undergoing major lifestyle changes though, it is good for you to have an idea of what's baseline because you will likely also be able to see over time some good changes taking place, okay? And if you're going to go through with me with the stage 5, which is undergoing a water-only fast, then you're going to want to get baseline no matter what, okay? And if you have any questions about these tests that we are going to be ordering and always order for all of our clients, please let me know. I'm going to go through them with you right now in this video so that you can have an idea of which tests you need to be on top of, okay? So we order through a laboratory here in Hawaii called Clinical Laboratories of Hawaii. I've been a provider and had accounts with Clinical Labs of Hawaii for, around 15 years. I really like this lab. They are Hawaii-based. They offer very, very competitive pricing for those that will be getting blood work that is not going to be covered by any health insurance. Now, if your medical doctor were to order these tests, your health insurance will pay for these tests, okay? Me, I am a doctor of chiropractic. If you'd like me to, I can order the test for you. However, your health insurance is not going to pay for a test ordered by a doctor of chiropractic, okay? But what I will be able to explain to you is that having the test ordered by myself is very helpful, only in the respect that I will be able to not only order all the tests that you want to have, which your medical doctor most often will not order all of these tests. However, if you make the request, he may be willing to. The other thing is that I'm able to interpret it, the results for you in a more comprehensive manner. Okay? So what we've done here is we've created some different panels that oftentimes all that I need to do is check the box because that panel has everything that I'm going to go through with you. Okay? Number one, we're going to go through a lot of tests that you're maybe familiar with, and we're going to go through some of the tests that maybe you're not familiar with, okay? But we're going to first talk about the CBC, which is a complete blood count with the differential, okay? The differential is where each one of the blood counts is specified with the percentages and absolute numbers, okay? So when we talk about the complete blood count, we're going to be talking about all of the cells, the total number of cells that make up your white blood count and your circulating red blood cell count, okay? So the white blood count is very important because this is your army, okay? And your army consists of the most clinically relevant white blood cells, which are your neutrophils, which increase when you have a higher level of pathogenic bacteria in your body, okay? So your neutrophil army, which protects against invasions of pathogenic bacteria, will build itself up, okay? And when it builds itself up, it strengthens its ability to be able to fight that pathogenic bacteria, okay? So this is very common if you suspect bacterial infection, to have a blood test which will show the complete blood count, and most commonly that neutrophil count is going to have gone up, okay? Now, when we talk about another type of infection which is all over the news, okay, consistently every day on the news, we're talking about viral infection, okay? Viral infection is very difficult to detect, okay? Their testing methods, or so-called testing methods of viral infections, are not very good, okay? So when someone is feeling symptomatic symptoms of fatigue, congestion, mucus in the nasal region, in the throat region, a soreness of throat, fatigue, fever, headache, all these different symptoms, and it's not identified by an increase in bacteria, okay? What we're typically going to see is we're going to see lymphocyte change, okay? The total lymphocyte count change, okay? And when it changes due to illness, okay, there's an attack on the lymphocytes. And the lymphocyte count will tend to be depressed, down, okay? When we talk about immune system, a lot of people talk, it's very common that people like to talk about immune system as though they somehow know what they're even talking about, okay? What they're talking about, or should be talking about, but they even themselves probably don't know what they're talking about, is they're talking about lymphocytes, okay? Lymphocytes, in general, are your immune system. If you have sufficient levels of lymphocyte count, your body can regeneratively heal very well, okay? Now, when it gets knocked down and depressed and reduced and lowered, that illness may take a lot longer to recover from because your body's ability to regeneratively heal is very low, okay? So let's talk about the lymphocytes. The lymphocytes are made up of your thymus cells, known as the T cells, okay? They're also made up of the bone marrow cells, known as the B cells, and they're also made up of the natural killer cells, known as the NK cells, okay? Those are your immune system, okay? Thymus, bone marrow, and natural killer cells, okay? Some of the other ways that your lymphocyte count gets damaged, okay, are these drugs that supposedly kill viruses, okay? What they actually do is they kill lymphocyte count, okay? The other thing that they do is that can decrease your lymphocyte count is the cancer-treating drugs that kill cancer, okay? When we talk about chemotherapy and radiation, those are the most damaging drugs or substances that you can allow to enter into your body to depress your immune system, okay? They do kill cancer cells, okay? Cancer cells being cells that are undergoing abnormal changes, okay? They call that those changes, they call that plasia, okay? Different grades and stages of plasia, okay? So chemotherapy and radiation will come in and it will destroy those cells, okay? But it won't just destroy those cells, it'll destroy anything in its path, okay? So when taking those drugs, just be a lot more familiar and understanding of what you are allowing to go into your body, okay? Now, viral illnesses that we eventually recover from, usually you're going to see that lymphocyte count be down for a little while, but it will reboot. It will regenerate and build those cells, those healthy cells back again, okay? We cannot say the same for poisons, okay? Poisons that kill your lymphocyte count, we cannot say that your body will recover, will regenerate those cells back again, because in my experience from looking at the blood testing of patients that undergo those poisons that they call therapies, it does not regenerate again, okay? And eventually these people get sicker and sicker and sicker. The same thing happens when we think about the illness that used to be very popularly talked about, which was the human immunodeficiency, human immunodeficiency virus, okay? HIV. It was very commonly talked about, and it was very important that certain SECTS, certain groups of people get tested for HIV, for the antibody HIV, which is a blood test to test for a type of antibody that the CDC gave a name to. They called it the human immunodeficiency virus. Get tested to find out if you are positive for the human immunodeficiency virus, okay? It's very interesting because most of the people that were getting tested didn't necessarily have any major health problems, but they were encouraged to get tested. Multiple sexual partners, gay people, and black people, people with higher amounts of melanin, okay? And so they were able to put a lot of people on a very poisonous drug known as AZT. And what they knew was that AZT would kill enough T-cell lymphocytes, okay, that eventually you would be diagnosed with a condition known as AIDS, Acquired Immune Deficiency Syndrome, which was diagnosed based upon a level of T-cell count, okay? And if the T-cell count fell below that number, then now you were someone known that had AIDS, also known as AIDS, okay? So these drugs that were created that were supposedly antiviral, okay, this was what they even gave the name something more that sounded more interesting. They called it retroviral drug, okay? They said that this retroviral drug will be good for you if you have that antibody, okay? Very interesting. Now what they've done instead is they've decided, you know what? Let's tell people that there's a vaccine. Maybe they had the idea that vaccine sounds more interesting and it's more of something that just everyone should do, okay? And so we don't have a lot of test results yet to look at lymphocyte count before and after, but there have been reports of testing that has been done that has shown that lymphocyte count is getting depressed, lowered, reduced after quote-unquote COVID vaccination, okay? So you have to be careful about allowing poisons to go into your body that you don't know what they are, because most likely all poisons to some degree or another will depress lymphocyte count, which will then depress immune system. Just helping you to understand, a lot of people talk about building immune system, okay? There's a lot of gimmicks and all kinds of, nonsense of supplements and take this, take that. To be totally honest with you, and for you to know, building the immune system is not really like something that you can necessarily do other than taking care of your immune system, okay? So by taking care of your immune system, you're going to eat a lot of fresh fruits and fresh vegetables the way God created it, because in the form that God created it is how you're going to get all of those ideas that are sold in pill form, okay? So the most important thing is not allowing you to allow poison to enter into your body, which kills the immune system, okay? So it's more about not allowing substances that will damage your immune system versus, being sold on ideas of building your immune system. There's no question about it. Eating healthy, exercise, sunshine, all of these things are good for your immune system and your overall level of health. But it's more important to not allow substances to poison your immune system, okay? So when it comes to the complete blood count, to finish it off, there are less relevant cells that are part of the white blood count, known as the basophils and the monocytes. The monocytes and the basophils are indications, can be clinically relevant in periods or cases of chronic inflammation, okay? The other white blood count to mention is the eosinophil count, which can be clinically relevant when we're looking at asthma, allergies, and parasitic infections, okay? Now, moving on, we're going to briefly review the red blood count, which is your circulating red blood cells, okay? These are very important because red blood cells consist of hemoglobin and hematocrit, which is, the hemoglobin is the oxygen portion of carrying oxygen to all of the tissues, okay? And so oxygen is very important when we consider blood, circulating blood flow, okay? Nutrients and oxygen, okay? So hematocrit is the volume of the red blood cells to the overall perspective of your percentage of blood cells. And then you have the other ones that all kind of follow along with your total circulating red blood cells, which is the mean corpuscle volume, the mean corpuscle hemoglobin, the mean corpuscle hemoglobin concentration, and then you have the red cell distribution width, which is the shape and size of the red blood cells. So if there's any abnormality in the shape and size, if they're abnormally enlarged, is when you'll oftentimes see problems. All of these can be significant when we're looking at different types of anemia. We've got the macrocytic anemia and the microcytic anemias, which we will go into further down as we go through. And then you have the platelet count, which is your blood clotting cells, okay? So you don't want too low and you don't want too high of a number of platelet counts. Obviously too low, the blood is not clotting, and therefore you're going to bleed all over the place. And if it's too high of a count, then that's going to lead to more clotting of blood, which is going to lead to dangerous health problems. Okay? Now let's go on to the comprehensive metabolic panel. So when we order blood tests, we're going to always order the differential of the complete blood count as well as the complete blood count. Okay? And then we're going to order a comprehensive metabolic panel. And the reason why we need a comprehensive metabolic panel is we need to look at the electrolytes, okay, which are essential for life support, and they need to be balanced, okay, especially when we're looking at sodium and potassium, okay? And these numbers can change depending on what type of diet that you may be consuming, okay? So if you're consuming a diet that's very high in potassium, which we might see in a fruitarian type of diet, where most of their consumption is fruits only, okay? Over a long period of time, this will lead to an imbalance. This will lead to way too high of potassium, way too low of sodium. And that's why it's very important to have a balance of potassium and sodium in your diet, okay? And fresh fruits, fresh vegetables, okay? You're getting your sodium, you're getting your potassium. You're getting your sodium, you're getting your potassium. You don't have to eat those high sodium and high potassium foods at the same meal, but over a period of 24 hours, you should have foods that are higher in sodium and foods that are higher in potassium. This is going to keep your electrolytes balanced, okay? From a dietary intake perspective, okay? There are other things that can attack against the body, which can affect the electrolytes. But, you know, we usually see that in periods where there's serious health concerns in that moment. Okay? The other part of the comprehensive metabolic panel that we want to go through is the CO2 and the anion gap, which is significant because when we look at CO2 and the anion gap, we're able to get an idea of the amount of alkalinity versus acidity in the body in that moment, okay? Then we have kidney function tests. We have the BUN, we have the creatinine, and we have the glomerular filtration rate, okay? And then we also have liver function tests, known as the AST, ALT, and bilirubin, which consists of the direct and indirect bilirubin. And we, when we go through each individual blood test, we're able to help people to understand what exactly the detail of what those tests indicate and where the numbers should ideally be and where your numbers are, okay? Another liver function test that is part of the comprehensive metabolic panel is the Alk Alkaline Phosphatase, okay, known as ALK-Phos. We also have the protein markers, which is the albumin and the globulin, which again, we need a good balance of albumin and globulin. So we look at the ratio of albumin over globulin to see if you have a good ratio of each of those proteins, okay? We have calcium, which is another vital mineral in the body, which is essential for healthy bone, okay? And again, we can go over and help you to understand if calcium is not normal, where it should be, and why it can become abnormal. And then blood sugar, okay? That is known as glucose, okay? So we want a good number when it comes to your morning blood sugar following a period of not eating for up to approximately 12 hours prior to having your lab draw, okay? Next, we're always going to order your lipid profile, okay? When we're looking at the lipid profile, we're looking at very important cholesterol numbers. We're looking at your low-density lipoprotein versus your high-density lipoprotein, okay? Your low-density lipoprotein attaches to arterial walls and hardens and constricts blood flow. Your high-density lipoprotein cholesterol is going to help to remove that hardening plaque low-density lipoprotein from the arterial walls, okay? And when we look at the health of the cholesterol, what we're actually looking for is we're looking for the ratio of the total amount of cholesterol, which includes your LDL and your HDL, divided by your HDL. So you want your HDL number to be higher. Your low density lipoprotein, most commonly you want it to be lower, okay? And the lower that overall number ratio of total to HDL, let's say your HDL is higher, that's going to give you a lower ratio, which is going to give you overall really good arterial health, okay? And all of these numbers can be changed with lifestyle changes, dietary changes, exercise changes, and the most drastic changes take place when undergoing a water-only fast, okay? The next one is we're always going to want to order your C-reactive protein, okay? You have the traditional C-reactive protein, which measures this type of protein that responds to inflammation, okay? We have the traditional C-reactive protein, which measures at a higher level, and we have the highly sensitive C-reactive protein, which measures at a lower level, okay? So having an understanding of an inflammatory marker that responds to inflammation in the body, our most useful test is going to be the C-reactive protein, okay? There's another test known as the erythrocyte sedimentation rate, which we always order for everybody. And the reason is because that is another it's a more non-specific inflammation marker, but it can be useful in certain conditions, okay? Especially with some of the autoimmune conditions such as rheumatoid arthritis and systemic lupus erythematosus, known as lupus, most commonly known as lupus. We're typically going to see some increase in that erythrocyte sedimentation rate. But again, you know, our most useful inflammatory marker is always going to be that C-reactive protein, okay? The other test that we always want to look at is we want to look at uric acid, okay? Uric acid is a type of acid that is the product of the breakdown of purine molecules, okay? Purine molecules are most commonly found in meat and meat products, okay? And plant-based diets tend to be much lower in uric acid. And so in order for you to have good kidney health, okay, so kidney health, you want to have lower uric acid levels, because as those uric acid levels increase, it blocks the filtration of the kidneys, okay? So that's the breakdown of the majority of what we're going to be ordering for most people. Everyone's going to be wanting to know their levels of all those tests that I just described to you, okay? Now, there's some other tests that we oftentimes will order when indicated, okay? When indicated, we may order a thyroid stimulating hormone test. It's known as TSH, okay? TSH is a very important number to know. Most people, as they age, tend to find that their thyroid gland becomes less active, okay? As it becomes less active, it became, or underactive, it can be known as a hypothyroid condition, okay? And that's when TSH levels increase over time, okay? So we wanna, most of the time, we want to know at least what your TSH levels are at some point. We may, depending on your age, we may not need to monitor it every 6 months, but we definitely should at least order a TSH once a year, okay? To see if your thyroid function is changing over time. The TSH is the most sensitive thyroid function test, okay? Because if TSH is changing abnormally, then we know that that's also going to affect T4 and T3, okay, which is very important for overall metabolic function of your entire body. Another test that often is indicated to order for people would be a random cortisol test, okay? And we're not going to take a blood test 4 times a day, okay? The blood is the most accurate, specific way to measure cortisol, okay? But typically what we want to see is we want to look at what is the number before 8 a.m., okay? So if you have good cortisol levels before 8 a.m., that's normal, okay? To have good cortisol levels in the morning, okay? And they tend to decrease as you get closer to bedtime, evening time, darkness, okay? Is when you want those cortisol secretions to decrease, okay? And if they're not higher in the morning and lower in the evening, then you begin to suffer what is known as chronic fatigue syndrome, okay? Oftentimes chronic fatigue syndrome may also have insomnia-related illness as well, where you have trouble sleeping at night, but then you have no energy in the morning, and you go on this vicious cycle of being really sleepy and groggy and tired in the morning and unable to sleep at night. And so many people suffer with this vicious cycle. And one of the ways that we correct that is by undergoing water-only fasting. Water-only fasting will correct underactive thyroid disease, and it will correct an imbalance in cholesterol, okay? And did I say cholesterol? I'm sorry. An imbalance in cortisol, okay? Cortisol is very important when it comes to all of the hormones, okay? So first you have to have cortisol correct if you want all your other hormones to be correct, okay? So I always encourage people that when they are interested in hormonal testing, let's first start with the simpler of the test, which is cortisol. Okay, if there's something wrong with cortisol, then you're not going to solve the other hormonal problems if you can't solve cortisol, okay? And so when we undergo water-only fasting, this allows those glands to regenerate themselves so that they can function normally again. And when they function normally again, then all the other hormones are going to fall in line. And that's, just one of the reasons why you'll have oftentimes females who can't get pregnant. They're not healthy enough to create new life, okay? And when they undergo a water-only fast, they get pregnant immediately, okay? Their body is clean, so their body can create new life healthfully, and they've got normal hormonal secretions again, okay? Which balances their estrogen and their progesterone, okay? And all the other hormones involved with these hormones, okay? These sexual and reproductive hormones. The next one that we sometimes will go over with people will be a prostate-specific antigen test known as a PSA. If there's any prostate disorder, PSAs can oftentimes be relevant clinically to be able to monitor the prostate disorder. Not 100%, not always, but in often times, a lot of cases, having a PSA test can help us to monitor what's occurring with the PSA, with the prostate. Usually prostate, you're looking at infection, that leads to prostatitis. Oftentimes can be an acute infection, or can be a chronic infection. You've got the benign prostatic hypertrophy, which is known as BPH, where the prostate is enlarged, but it's not a malignant type of cancer. And then, of course, you have the malignant prostate cancer. Okay. Now, the other tests that can be indicated for people to have done would be vitamin D, OH25. Okay. This is the most specific vitamin D test to test for sufficiency or deficiency of vitamin D levels. Okay, vitamin D is very important in the role of your immune system, and so we need to have sufficient levels of vitamin D. The best way to get your vitamin D source is with sunlight. So you need to make sure that you get your physical body out in the sunlight as often as possible, every day if possible, okay? Now, when we talk about things like supplementation, there's very few things that are indicated for supplementation, but sometimes vitamin D can be one where we will recommend supplementation, okay? Now, when it comes to restricted diets, there's certain tests that we should do for people that are on restricted diets. And when we talk about restricted diets, we're most commonly talking about people that are on a vegan diet, where they will not partake of any source of food that comes from any type of animal, including honey. And so when we're thinking about those types of diets and people who have been on that type of diet for 2 years or longer, then we need to make sure that we're checking these levels, okay? And there's a host of tests that need to be done. We can't just take 1 or 2 of these. We have to have the entire spectrum of these tests, because without the entire spectrum, we're not getting a full picture of what may or may not be going on. vegan diets for a period of up to 2 years are typically never going to have any signs of deficiency occurring because the liver stores a certain amount of B12 that typically will not need to be replenished for a couple of years. And so restricted diets of veganism or vegan dieting can be very useful when people are cleansing their human body, when they're cleansing their human vessel, because the foods that contain vitamin B12 are made up of large molecules that are more difficult for the body to break down. They take more time to break down. And so when you are not fully cleansed, breaking down those molecules is oftentimes leading to more health challenges and not allowing the body to fully heal itself. And so a vegan diet made up of primarily fruits and vegetables can be very, very healing. And so most often we even will have people on vegan diets for a period of time. Now, if we take it to extreme levels where someone is now, continuing with vegan diet for 2 years plus, it may or may not still be healthy. That's why we want to take a very comprehensive look. We will need to look at vitamin B12. We will need to take a look at vitamin B9. Okay, B12 is known as cobalamin, and B9 is known as folate. Okay, so vitamin B12 and folate. Okay, now those tests may be indicative or may not be indicative if there is a B12 deficiency. Okay, the other tests that we need to look at are, we have to look at homocysteine, which when elevated affects cardiovascular health, and when elevated is attributed to your vitamin B12 and vitamin B9 levels. Okay, now to distinguish between vitamin B12, folate, homocysteine, we need to get a methylmalonic acid test. Okay, if methylmalonic acid levels are increasing, we know that B12 is decreasing. Okay, so B12 is essential for the breakdown of methylmalonic acid. Okay, it's another type of acid that can build up in the body and cause other health problems, neurological problems, and impaired gut absorption problems. Okay, so we need to be very, very careful about being on restricted diets for a long time. Okay, and when we're thinking about long time, we're thinking 2 years and above. Okay, the other tests that we typically will want to look at when people have achieved levels of deficiency is we'll want to take a look, number one, of course, at your red blood cells, which will indicate if there's types of anemia. Okay, if there is any type of anemia going on by your red blood circulating cells going down due to microcytic anemia, or going up due to macrocytic anemia, okay, then we will want to look at your total iron spectrum. Okay, total iron spectrum, we will be looking at your serum iron, which is your total iron circulating. Okay, and then we're going to be looking at transferrin saturation and your total iron binding capacity, known as TIBC. And along with that, we're going to take a look at ferritin levels. Okay, and ferritin levels can be affected by other health factors, but when it comes to your total iron transferrin saturation, and your total iron binding capacity, we know that that is related to iron, okay? And we know that our most concentrated forms of iron come in the forms of meat, okay? So sometimes people need to eat meat in order to get healthy levels of circulating red blood cells and iron as well. Now, when we look at the macrocytic type of anemia, that's where we look at the B12 levels, the methylmalonic acid, the homocysteine, etc. Okay, so this is a snapshot of the blood tests that you need to know for your body, okay? And when it comes to the next stage, we're going to talk about water-only fasting, okay? In the next stage, all these blood tests become even more important because we're now seeing drastic changes take place in a short period of time, okay? So I hope that you found that useful. If you have questions, you can contact me and I can answer you directly. Like, share, subscribe, comment, and we will see you in the next video, which is now going to take you on your path to higher level of health. Mahalo.